Hey there, welcome. This is your H Care. How to use a face mask correctly. Wearing a face mask often helps people feel protected and reassured. But can a surgical face mask keep you from being exposed to or transmitting certain infectious diseases? And, if face masks do shield you from infectious diseases, such as COVID-19, is there a proper way to put them on, take them off, and discard them? Keep watching to find out. What is a surgical face mask? A surgical mask is a loose-fitting, disposable mask that's rectangular in shape. The mask has elastic bands or ties that can be looped behind your ears or tied behind your head to hold it in place. A metal strip may be present at the top of the mask and can be pinched to fit the mask around your nose. A properly worn 3-ply surgical mask may help block transmission of large particle microorganisms from droplets, sprays, splatters, and splashes. The mask may also reduce the likelihood of hand-to-face contact. When should you wear a face mask? The World Health Organization recommends using surgical masks only if you have a fever, cough, or other respiratory symptoms. Are well but caring for someone with a respiratory illness. In this case, wear a mask when you're within 6 feet or closer to the person who is ill. Although a surgical mask helps trap larger respiratory droplets, it can't protect you from contracting the novel coronavirus, which is known as SARS-CoV-2. That's because surgical masks don't filter out smaller airborne particles. Don't fit snugly on your face, so airborne particles can leak in through the sides of the mask. Some studies have failed to show that surgical masks effectively prevent exposure to infectious diseases in community or public settings. At present, the Centers for Disease Control and Prevention, CDC, doesn't recommend that the general public wear surgical masks or N95 respirators to protect from respiratory illnesses like COVID-19. Healthcare providers and first responders need these supplies, and there's currently a shortage of them. However, in the case of COVID-19, the CDC does advise the general public to wear cloth face coverings to prevent the spread of the disease. The CDC also provides instructions on how to make your own. How to put on a surgical mask. If you need to wear a surgical mask, take the following steps to put one on correctly. Steps to putting on a face mask. 1. Before putting on the mask, wash your hands for at least 20 seconds with soap and water, or rub your hands together thoroughly with alcohol-based hand sanitizer. 2. Check for defects in the face mask, such as tears or broken loops. 3. Position the colored side of the mask outward. 4. If present, make sure the metallic strip is at the top of the mask and positioned against the bridge of your nose. 5. Mold the bendable metallic upper strip to the shape of your nose by pinching and pressing down on it with your fingers. What not to do when wearing a surgical mask. Once the mask is positioned securely, there are certain precautions to keep in mind to ensure you don't transfer pathogens to your face or hands. Do not touch the mask once it's secured on your face, as it might have pathogens on it. Dangle the mask from one ear. Hang the mask around your neck. Crisscross the ties. Reuse single-use masks. If you have to touch the face mask while you're wearing it, wash your hands first. Be sure to also wash your hands afterward, or use hand sanitizer. How to remove and discard a surgical mask. It's important to remove the face mask correctly to ensure you don't transfer any germs to your hands or face. You also want to make sure you discard the mask safely. Steps to taking off a face mask. 1. Before you take off the mask, wash your hands well or use hand sanitizer. 2. Avoid touching the mask itself, as it could be contaminated. Hold it by the loops, ties, or bands only. 3. After removing the mask, wash your hands thoroughly or use hand sanitizer. What is an N95 respirator? N95 respirators are form-fitted to the size and shape of your face. Because they fit your face more snugly, there's less opportunity for airborne particles to leak in around the sides of the mask. The key to an effective N95 is to ensure that it fits your face correctly. Healthcare practitioners who provide direct patient care are fit tested annually by a qualified professional to be sure their N95 fits them snugly. A properly fitted N95 respirator usually filtrates pathogens in the air much better than a surgical mask. Respirators that have been carefully tested and certified to carry the N95 designation can block up to 95% of tiny, 0.3 micron, test particles. But they also have their limitations. What works best to limit infection? If you have a respiratory illness, the best way to minimize transmission is to avoid other people. The same applies if you want to avoid contracting a virus. To reduce your risk of transmitting the virus, or coming into contact with it, the WHO recommends the following. Practice good hand hygiene by washing your hands frequently with soap and water for at least 20 seconds at a time. Use hand sanitizer that contains at least 60% alcohol if you don't have access to soap and water. Avoid touching your face, mouth, and eyes. Keep a safe distance from others. The CDC recommends at least 6 feet. Avoid public places until you recover fully. Stay home and rest. The bottom line. Surgical masks may protect against larger airborne particles, while N95 respirators provide better protection against smaller particles. Putting on and taking off these face masks correctly may help protect you and the health of those around you from transmitting or contracting pathogens. Although face masks may help reduce the spread of some disease-causing organisms, evidence suggests that using face masks may not always protect you or others from exposure to certain pathogens. If you are new to this channel, consider subscribing. Check my other health tips videos. Also like, share and comment. Thank you.